Good afternoon, everybody, and thank you for allowing me to present in this way. I'm hoping that I will be able to cover as much as possible. And once I am done with my presentation, you are welcome to ask me questions, which my colleagues will facilitate. Elise Archer and myself have conducted a study in the MBCHB program at Stellenbosch University last year, in which we tried to create an authentic assessment for students where they had to perform a sterile procedure, in this case catheterization, on a model in the simulation lab, and then submit this after formatting it onto the learning management system. The reason that we try to do this is because the literature tells us that in order to learn a clinical skill, a student needs to practice numerous times, and they also need to have okay, you see there, my dog barking. They also need to have quite a bit of feedback and fairly quick feedback from lecturers in order to learn this skill. Now, with this skill, what we wanted students to do was to create a video using any form of recording device that they chose, and then submit that when they felt they were ready to be marked. The lecturer would then give feedback, either verbal or written, to the student, and they could then use that in preparation for the OSCE. The feedback that we got from the students, we got via survey, and this was interesting in that students were quite negative. They voiced frustration at the number of times they had to record this video. They felt that the amount of time that it took actually didn't make it worth their while, but at the same time they said it facilitated their learning. It helped them, as many times as they had to do this, it helped them actually feel confident and competent in performing the skill on patients in the hospital when they went into their clinical rotations. Lecturers, on the other hand, through the focus group discussions, told us that they felt incompetent many times when it came to the technology. They couldn't help students with questions about formatting or with uploading, and so their digital literacy or illiteracy was actually highlighted through this project, as well as the amount of tech support that we had to give lecturers in terms of training them using Camtasia Studio software, which they used for their feedback purposes, but then also in terms of how to download videos. I mean, something that we may think is quite simple was actually quite difficult for some of the lecturers. And then the plus side from the lecturers was that they actually found that seeing the students create or perform the same thing over and over, which was incorrect, helped them to realize what they were doing wrong in their tutorials or what they had to change in their teaching. The biggest I think the biggest outcome that we had from this study was realizing how expensive it is to actually create these kinds of authentic assessment opportunities in a skills lab. The number of catheters that had to be bought, the number of sterile packs that had to be bought, doubled if not tripled in the year that we did this study. And the skills lab management, as well as the lecturers, felt that this was not a case of, the ends justifying the means. They felt that the students practicing often was a good thing, but they didn't want to spend that much money on the resources. And this is what our take-home message is for this study, is that yes, authentic assessment is good. And in health professions education, we already have authentic assessment where students work on patients and we evaluate them while they are working with the patients. But authentic assessment outside of a clinical environment or in a skills lab can be very expensive and needs to be taken into account in our resource constrained environment that we find ourselves in. And we need to think of ways to actually create the same type of practice makes perfect environment without tripling our costs, because this is extremely hard to justify in our current context. So thank you, and I'll hand over to my colleagues so that they can connect us up for one or two questions. Thanks very much.